Good. Okay, perfect. So thank you everyone for joining today. And it's our second learning series of the year. So super looking forward to this. We are going to be basically talking with Lisa today, who's the mental health lead of the Northwest Catholic District School Board, and kind of building off the last learning session. If you didn't get a chance to participate, you can find it on our YouTube channel. But we're building off that last session to kind of look at how Lisa has been able to use the data gathered in EMH to enact meaningful changes within the mental health programming within the school board. Some housekeeping items. I'll be moderating questions, so please put your questions into the chat or the FAQ, and we've dedicated some time at the end of the conversation today to go through that. So if you have any questions whatsoever for Lisa or for Maria, please put them in there and we'll get through it at the end. But with no further ado, I'll pass it off to Maria.
Well, I'm so incredibly excited to be here with Lisa Devlin this morning, Lisa being the mental health lead, and an incredibly important and pivotal role within a school board. To give a little bit of context, we have been excited by the things, Lisa, that you have been doing and how you've actually enabled not just better service and better support, but supported funding requests and funding decisions on the back end in terms of the proof in the pudding from a data point of view. And so I'm incredibly excited to chat through that. And thank you so much for doing us the honor of joining today. And welcome everybody. As you know, we're doing this webinar series this year, and with really the goal and intent of giving some tricks of the trade and some tools and some stories on how our partner customers are really using the data to enable better service. And so, Lisa, tell us a little bit about you.
Hi, thank you very much for having me, and thank you everyone for being here. I'll start by my disclaimer. I have no formal data analysis background, so I always like to start with that. I am a social worker. I'm a registered social worker. I've been practicing for about 20 years in various capacities in Northwestern Ontario, in particular the Kenora Rainy River District. I've worked in brain injury rehabilitation, child protection, mental health counseling, and prior to coming to this job, I was the manager at a community-based organization for counseling and treatment. And for the past 4 years, I've been the mental health lead at the Northwest Catholic District School Board, which is where I am now.
Well, you know, one of the things that always hits me is your disclaimer at the front. So the truth of the matter is that the disclaimer, you're probably like most people who are actually listening in today, and most of our customers, right? It's only the large organizations that have someone who often has what I'll call a career data background. What's exciting for me, Lisa, is the way that you've kind of identified we have some problems here. Here are some ideas on how to tackle it. Here's how the data has enabled you to make the decisions and get support for those decisions. So that's why you're here, because I think you've got so much to offer in the conversation around challenges, and particularly at the school board level. I mean, as you know, you're a really important partner of ours because you're doing some really cool things. But there are many school boards that are in either much further behind where you are and can learn from this, or just starting their journey. And so that's what I'm excited about. So tell me a little bit about a typical day as the mental health lead at TNCDSB.
Sure. So we're unique in that we're a junior kindergarten to grade 8 board. Most boards have high school, secondary students. We are primarily an elementary board. We're located across the Kenora Rainy River districts. So we have schools in Stratton, Atikokan, Fort Francis, Sioux Lookout, and Dryden. So to drive from one end to the extreme of the other, it's about a 5-hour drive. So we've got hundreds of kilometers between each of our schools, which makes us unique. We don't have schools co-located in a community that most boards do. So a lot of my time workers and educators managing, the mental health needs of students, any student crisis that comes up, helping to navigate service pathways. I'm the lone social work manager, so the only person in a management capacity that's a regulated health professionals. So things like privacy legislation when it comes to students' health information, making sure up to date on that, making sure our policies and procedures are up to date, and of course, managing our electronic records of student services.
Well, we chatted a little bit about electronic records of student services, and I know we're going to dig in a little bit. But now that school boards are front and center and often that first step in not just identifying the need for mental health supports, but being there as that facilitator and that support for a student and sometimes a family. Now you're in this unique position of actually storing health records properly, which is always a little bit challenging, right? Whether it's a paper record or it's an electronic record. I know that was one of the things that you and I had talked about was the impetus and one of the reasons that you had looked for a system like an EMHware product. And so, that's one of the challenges that I would say that you face in your environment. What are the challenges that you're seeing today in the student body, right? We've seen so much with the pandemic and not just the student body, I should say, the student body and the teachers, because everybody had to go remote. Now that we're back in person, there's a lot of learning that would have happened earlier for students. There's a lot of things that may have slipped through the cracks. So what are you seeing from a student point of view and then potentially even a teacher point of view?
Yeah, and so it's unique in education because the education system hasn't always had mental health built in. So there's always the added challenge of navigating mental health services, with regulated health professionals and health information within an education system, because there's different legislation. We are governed by different legislation than educators. So a big challenge is educating the system and the board about our privacy requirements, why we aren't able to freely share information, why we require parental consent to share information to see students. So a big challenge is educating the system on how we're different from educators, and also empowering educators to feel comfortable doing their part in creating warm and welcoming environments for students, because there's so much more that needs to happen for student wellness than just the individual services that we provide. So it's a big challenge to advocate for mental health within an education system, to give people the skills and the confidence to be able to be there for kids in a positive way and help student mental health. You referenced the complexity of need coming through with students and families is really increasing. Families are struggling, and it started before the pandemic. Pandemic certainly didn't help things. So we're seeing an increased volume and an increased complexity. And our school-based mental health services were actually funded and set up for brief service for mild to moderate struggles. So it's really hard to manage higher intensity situations when we're set up for the lower intensity. And of course, like ever, we have major staffing issues. In particular in the north, it's really hard, and I've heard that everywhere has it. In our whole sector, not just mental health, we are really struggling to hire and retain qualified school counselors, qualified child and youth workers, qualified educators. Staffing is a major issue in our system. So it's the complexity of needs, them having the people to complete the needs, having the system understand how we're different and what our requirements are. And of course, managing remotely, because being spread out so far, I'm never physically in the building as the people I supervise on a regular basis. So providing support remotely can be a challenge.
Well, and I can imagine as well, one of the further complexities you have is you may have a child in crisis who's in a remote community where there are limitations even to that step up approach and those partners, those community partners that you can engage. So it's not just the complexity of you supporting those who are providing the support in the classroom, the teachers, but the mental health counselors as well who are at the school level. But I can imagine it's also complex because you don't always have a partner in the community who can pick up the phone and say, hey, I need you now, because that community may actually be 100+ kilometers away from the actual child. When we were chatting, getting ready for this discussion, you had mentioned, when you were starting out and really just trying to get the lay of the land and understand kind of where the challenges and the gaps were. What do you see? Tell us a little bit about that journey, because to me it was really interesting, especially given your disclaimer at the front that you're not a data person. I think you're a great data person, but I can certainly understand your point of view on that.
Yeah, absolutely. So prior to this position, I worked in a community-based agency that had a quality assurance person, that had someone who handled the electronic management system. They had very robust policies and procedures in place for managing information and privacy because they've been doing it for a very, very long time. So when I came to this leadership role, as any leadership role, the first thing you do is have a look at your policies and procedures and start from there. And there really wasn't any specific to student mental health. So I had to start from scratch. And one of the
Wow.
first things that jumped up is accessing student information to be able to see, because I'm not on site, to be able to access the life cycle of services to students, to make sure that information was accessible in an organized way, to make sure that our database was compliant with privacy legislations. That's very, very important in the litigious society we work with, and students' information deserves to be kept private and secure. Those legislations are there for a very good reason, and we need to honor that. So it was a lot of redeveloping policies and procedures. And so I took with me what I learned from my previous employer and the previous roles. So I knew kind of what data could be pulled. And so we started to kind of build from there, getting a system in place, starting to pull data from the system to really get a better look at the services, the length of time, what type of referrals are we seeing? How long are we seeing kids? What exactly are we doing in session? And all those things, you're not there. How are you going to get that information to advocate for adequately funding and allocating your resources? So it was a lot of research, a lot of drafting of policies, and a lot of drawing on my colleagues' previous employments. And yeah, just kind of built it up from there.
I think, anytime you start a role, it's somewhat similar, but often when you do, you're coming in and there's a set of kind of standards already in place, right? Standards of care, standards of practice, policies and procedures. So it's really interesting to hear more about that journey as you have put those things in place. But it's not like you had 3 years to step back and go, let me make it perfect. You still had to actually deliver service and, identify that low-hanging fruit pretty quickly. There were a number of really interesting things that you have done in your 4 years there that have had real positive impact, not just on care, but on the discussion around funding. One of those is the transition of care program and project. Would you like to take a couple of minutes and explain what transition to care means in the context of a student and a school board organization?
Yeah, so just to kind of give it a little bit of background. So there's things that we're required to report on to the Ministry of Education, and then there's things that we just want to know because it helps our service. So we are required to report how many students we refer on to a higher intensity service, which is really important information. We work really closely with our community partners of the higher intensity service. We couldn't do this without them. So it's really important that we track how we flow work together. So that means when a student is outside of what our capacity or our mandate is to provide service to, we need to refer them on to a community-based agency where they can get the appropriate care for their needs. So part of that is at first we were just collecting raw data. We sent 26 kids in this community to this agency. And what we were finding is we started to look at every year we would get the same kids referred back to us. So we started to wonder, like, what's going on? Why are they back to us? I thought we referred them on to a higher intensity service. I know that agency is wonderful and they really provide great services. What happened? So we decided it was important to take a deeper dive. We do meet regularly with our community partners that we refer to, and we talk about, referral issues and what they're seeing in terms of trends. And so internally, we started to analyze the data. And when students were coming back to us when we'd previously seen them, we saw that about anywhere from 25 to 35% per year of student referrals we get were repeat clients that we'd already seen before. So we started to look at that and, how can we make more successful closures? How can we make sure students are getting what they need? So we dove deeper into that data, and of that 25 to 35% range, it's different every year. Almost half of those were closed because they were redirected to a higher intensity service. So that really spoke to us that something is happening in that transition period that we need to look at and figure out how to better support these transitions. And it could be a variety of reasons. We started to dive into it. Some of it is once we refer the family or the student didn't actually follow through with engaging in service. And there could be a lot of reasons for that, and we're working on that. So we started doing things like having joint sessions the first couple of times to build that familiarity in a place with a person that the student is already comfortable with. To hope that might ease in transitions. We put in a protocol in place where we can't just close a file once we make the referral. We have to leave it open and monitor until we can confirm on the other end it's been assigned to a clinician and they've made contact. Because that was the other thing. Sometimes, unfortunately, these services have wait lists because just like us, not enough people to do the work. So the motivation to change, sometimes months of sitting goes away. So then we looked at, do we need to we need to check in then with the process while someone's on the wait list to see how they're doing to try and keep that motivation going. So those are some of the things that we're looking at to have that number start to come down. But until we actually looked at the data, we were just guessing what the issue is. So it was really helpful to dive into it and see what's really going on.
Well, it's interesting, Lisa, because we have a lot of client partners who are now coming as a cohort and saying, can you help us look at this data together? So not just our data that says who we've referred to or who we've taken in, but the community across the entire region to say, this student, this child, this family has been seen in 5 different places, and this is the amount of time they're waiting, and to really start to dig in and understand some of that. Because at the end of the day, as a region, to be able to say back to the ministry, this is what we're finding. I was at the eHealth conference. There's a lot of discussion about information and records and summaries traveling with an individual as they go point to point. But it really struck me, it's really, really great that they're doing that work, but it so hasn't hit the level where people are actually doing the work on the day-to-day basis. And then, you are in a position like you are where you're actually working on programming. And so, as I heard about your transition of care plan, it really resonated because I think that is a key thing to make sure that, a child, a parent has that not just the transition to here's your referral, but that help and support and somewhat hand-holding to make sure that they're comfortable as they transition to a new clinician or to a new practitioner, and that there's kind of follow-ups and checks. Because I'm sure from your point of view, as you're seeing kids come back year after year, at some point they're going to age out of your system. They're going to be somewhere else. And we know that earlier intervention, impactful early intervention actually can help. The other thing that you spoke about was the increase in grief referrals, post-pandemic, where everything or the main focus was around anxiety and managing children's anxiety. But now here we are, particularly in your cohort of students, where family challenges and grief comes to the forefront. Tell us a little bit about your grief training that you've done in classroom and the impact that has had.
Yeah, and so being an elementary school board, it kind of caught me off guard having so many grief referrals. These are elementary age kids. You would imagine that wouldn't be a high level of referral, but in particular in the area, and it just speaks to kind of the crisis that we have in our area with families struggling, lack of access to preventative health care, and just the more complex nature of the struggles that families are facing. So when we started to dive into yearly data and we compare year to year the top types of referrals, we noticed that grief was trending up, and I was surprised to even see it at all as one of the top referrals. Like obviously it would always happen, but never as something so common. And really the staff felt ill-prepared to manage it, as did I, because it's not something that we would prepare for. You know, we're prepared for anxiety, depression, social skills, things like that you would typically imagine you'd see in a elementary school. But to see the increase in grief referrals, we really flagged for us something that staff didn't feel equipped to work with. So we started to monitor that and reached out and sent staff for various training on how to support students through grief. And also from that materials to cascade so that the system knew how to support students with grief, because there's a lot of panic. Oh my God, the student lost someone, like we've got to, you know, and just the importance of keeping that calm environment and the importance of structure and routine and how to support kids through grief was a learning experience as a board. So having, after sending staff to training and them having resources and messaging to cascade through the system, they feel a lot more comfortable and ill-equipped. And I will say the outcomes for our grief referrals, about at least 80% closure rate, is successful achievement of goals. So we've seen a lot of success with supporting kids through grief with the additional training we've provided. And just by looking at the data, we were able to flag that conversation, and that's an area we needed more support with.
Well, you know, I love the call out on the data, right? Because you're not just implementing, you use the data to enable to say, this is a challenge, here are options to manage it. But then you've gone on the back end and measured the impact of that data. You know, one of the other things that I think is incredibly impactful that you've done is mental health training and curriculum within the classroom, and having somebody come in. And you'd mentioned that last year you hit 76% of all classrooms. This year you're at 100%, but you had pretty profound results as a result of, as an outcome of that. You know, suicide prevention, and the number was astounding to me that even in that cohort, frankly, it would be something that we would have to be worried about, but clearly it is when you're preventing them. Decreasing wait times, you know, 200 parent consults, like to have the ability to track that data. Did you want to spend a couple of minutes expanding upon that program? You know, how did it come to be? What are the types of things that you're actually addressing as part of that curriculum? And how are you actually tracking and measuring the outcomes?
Yeah, so school board mental health services are funded for prevention, early intervention services. So that's a large part of what we are supposed to be doing. It's really challenging in a school system where often it's the reaction to crisis or pertinent issues. So to get that upstream mental health programming it's been a big learning, and we are by no means where we want to be, but we're definitely further along than where we started. To get that buy-in for universal programming is really, really difficult. So we started with the individuals on the ground, just kind of talking about, hey, we've noticed, you know, I'll use the example of on graphic images online. That's a problem throughout the society. You know, we've been a lot of reports of inappropriate texts and things like that going on at this particular grade level. We have a program that is evidence-based that we think can really help mitigate some of this in your classrooms. Will you let us do it? So we started kind of organically on the ground promoting ourselves and how this program can translate to things that are tangible, because the issue with prevention is it's really, really hard to measure what didn't happen because you did. So over the years, we've had staff dedicated solely to in-class programming, and we've been extremely protective of that. And that has been, anyone else in a school board can attest how incredibly difficult it is to protect that role. So we started to track which programs, which school have we had the most uptake, which classrooms are hardest to get into. So then we'd look at that data and say, okay, grade 6 in this school, we haven't been getting in. Let's talk to the principal, see what the pertinent issues are in that classroom, and we'll pick a program that's evidence-based to help assist with that type of issue. So then we marketed it that way, and that's kind of been our strategy to climb up towards 100%. And just really, it's about working with the school on what hot button issues are important to them, because we're not we have to be invited into the classroom. We can be assertive in what we see, but we do need the buy-in from the educator. So it's just been really intentionally collecting data where we have lots of uptake. Can those people talk about the successes? So we made testimonials of people who have had us in, and we shared it with the places that we're trying to get into. And we've slowly climbed our way to 100%. And then what I do at the end of each year is I do some statistics on this is what we've seen. Referrals have gone down for more intensive services in this class, in these cohorts where we've had the most services. We've had less instances of certain things reported. We've made it X amount of classes. Our goal next year is 100%, and we reached that this year. So we also report back on the positive data just to kind of validate like this, and it is working. We are reaching our goals to kind of keep that momentum.
Well, it strikes me that it doesn't matter what role we are in or what types of organizations we are in, there is always a sales and marketing process that is required. And I will say I'm somewhat astounded that given globally, particularly in Canada and in the regions that are similar to yours, that as the mental health lead, you actually have to sell your services to convince those people who are in the classroom to say, yes, please come in. But it really speaks to the continued need to manage stigma and to manage environments where people don't feel that by your coming into their classroom, it shows that they're actually not doing something wrong, right? Which we work on across all organizations every day, which is, how do you help people feel empowered to reach out to get the expertise that they don't have? And frankly, no one would expect them to have, to bring in those experts that actually can be really helpful. And in this case, it, has pretty, not just impactful outcomes, it can actually mitigate pretty serious situations. One of the things as we talked about this was using the power of data, not just to go and say, hey, I need funding, but as well that closed loop approach that you've taken to going back and saying, hey, you gave us this funding, want to show you that impact. I would love it if you could share with everybody kind of your, not just your philosophy and approach on that, but the success that you've seen from a funding point of view as a result of that approach.
Yes, absolutely. As a publicly funded agency, I think it's incredibly important we're accountable for the success of the programming and the resources that were allocated. And while we do report various things, I feel what we report doesn't always represent the true life cycle and success of cases and kind of doesn't paint a whole picture. So when we obviously, like, and when we go forward, we have all kinds of data to advocate for more programs. This is our wait times. We have students waiting. We've seen this amount of students. The needs are such. But often the feedback loop is never closed. So what we do in our board, and I think a lot of people probably do this, is we make sure that a big part of our presentation to trustees and families talks about the successes of the program and what we did with that money and proof that it did what it's intended to do. So it's very important. Every time I advocate for an additional position or a new service, I always make sure to close the feedback loop to come back at the end of the year and talk about all the good it did. Because of this additional position, I can say in this school, we've reduced wait times to 0 days, which is true for one of our schools. Because of this position, we serviced 50 more kids than we did last year. We had 200 more parent contacts than we did last year. Our successful closure completion rate went up. And so just making sure you're closing that feedback loop just to rationalize and made a good decision, believing in us and allocating resources and that we're doing what we intended to do. But that also sets the tone for future requests. If you can demonstrate you've been able to been successful with the resources you've been given, that really sets you up in the future when you need to come back and ask for more, that you have that credibility, that you do what you say you're going to do, and you come back with facts to back up that it was a good investment and positive result came from it.
Well, I think that is a fabulous approach, and certainly that evidence-based closing the loop not just helps people feel really comfortable that you're not always just knocking on the door asking for money, but that you're actually showing what you did with that and the benefit that it has had within the school system, which I think is really important. From a future point of view, what are the things that you're looking to tackle, challenges that you still see?
Yes, so definitely collecting and analyzing identity-based data is something that we really need to improve on internally. And that's a focus moving forward. When we're looking at outcome rates, when we look at them as a seeing certain identities that are overrepresented in certain to data, looking at our outcomes and making sure that there isn't identity groups overrepresented in some of our data, and that we're not missing any gaps, just to make sure that when we're talking about successful closure rates, that we mean it and that nobody has been left behind by not thoroughly looking through the data, because evidence-based does not always mean for everyone. So we really need to make sure that the programs and the services we have are not leaving unintentional gaps for people.
Yes, that really resonated with me when we talked about that. Not just looking at the surface. I mean, we know a lot about data is what you're trying to prove, and sometimes you can make the data say what you want it to say. But when you start to dig in and you go through the layers, you actually can't do that anymore. There's nowhere to kind of massage and hide. And your focus on doing that, I think, is admirable. And that's why I chuckle at the beginning when you start with your disclaimer of I'm not really a data person. Oh, come on. Because I actually think that, as I said before, I think you are. I wanted to leave a few minutes for some questions. So Peter, did you want to jump back on and ask the question? Do you want me to go ahead with that?
I've got a couple questions here.
Perfect.
So thank you, Lisa, Maria. This has been an amazingly interesting conversation. And this will be uploaded, by the way, on our YouTube channel, everyone. So feel free to share that link across your entire organization. But I have a two-sided question here, Lisa. You were paper-based before joining school board, correct?
No, we were using an American system that was primarily built for medical billing.
Okay,
And we
perfect.
had old paper files too that we had to migrate on. So
Okay.
yes and no.
That's excellent. So one of the questions here is how long did it take for the adoption of the new system, and was there anything that you did specifically to kind of help move that along?
Yes. So now this answer, I was very lucky in timing. So when we came on, we started and we said, we're going to start this year on this system and we'll go from there. So we kept the old system. We started just getting used to EMHWare for the first couple months for the first year. Now we were lucky when we were migrating, there was COVID funds. So we did pay a staff over the summer to scan. So it probably took, and because we hadn't been running for very long, there wasn't as many paper files as you would think. So my experience, we paid a staff over the summer with COVID funds to scan in. So it took about 4 months. And then from there, we just went 100% onto EMHWare.
Awesome. So just about 4 months. That's excellent. Culpreet has a question here. Did you use the reports feature to gain the data for referral reason, duration of service, or type of support? And how were the stats on this data received or retrieved? Excuse me.
Yeah, so prior to this previous role, I would mess around with the reports function quite often, and just kind of, you would come into like, oh, there's a report for this, because it looks a bit different, but there's quite a long list of reports. So honestly, because I'm not a data person, I don't have any formal training, I just started by looking at all the different types of report and playing around with them. So most of this comes from report. There's a few where I'll migrate to an Excel spreadsheet and kind of look through it. Although if I bothered to ask, there's probably a report to do what I wanted to do, but with a smaller data set, I just manually redacted some of it from Excel. But the bulk of my information does come from report. What I do is if I want to track a type of service or I'll make it a specific activity, because it's really, really easy to track what you're doing when it's an activity, to pull the report on activity. So that's my suggestion. I find it easiest. If I want to track something, I make it an activity, so then it's just added to the case note. And that's by far the easiest way to track stuff and pull data.
Excellent. I am not able to hear you guys right now, but I do have one more question if you could hear me.
Hear you.
Okay, perfect. Now you're back. Can you talk in more detail about the transition plan after students leave your school board, and what happens?
Yeah, so in every situation's a bit different. It depends on where they're going and whether or not there's a wait list. So what happens is when we're referring on to another service, and it also depends on the location and who we're referring to. So typically when we make a referral, you do the completed paperwork. We explain to the client, and depending on age, the caregiver, if the client is not old enough to consent, we explain to them kind of what's going to happen, where we're sending your information, what's the next step. So we send the referral over, we always make sure we document that. And then we confirm that it's been received on the other end, we document that. And then we give choices, right? Because we want to make sure this works for the client. So we give the client an option. Do you want us to come with you for your first intake appointment? Do you want to have it here at the school? We can invite the person here, or we can join in the community or join virtually, whatever if the person wants that, then we can offer that. And then following the meet and greet, so to speak, then in that session, they would agree when they're going to go to the community providers agency and the time. And so that'll all be documented. So it's almost like a case conference. If there's a wait list where they're going, then our process is we check in, say it's once a month with both the provider and the client to see if they're still on the wait list. We do ask our providers to notify us when they pick up clients, but that doesn't always happen. So we do still call. And then once we've confirmed with either the client or the other agency that they've contacted them, that they're picked up, that they've started to meet with them, then we would do the file closure on our end.
Excellent. We just had one last minute question pop in here. Are there any struggles with collecting data in the classroom related to not having the time?
Yes. So we have our child and youth workers do the bulk of our in-class programming. And so that's built into their daily schedule and how much work I assign them, that they have time to make sure they go back and document. We find documentation takes maybe 2 minutes to document a note. And so for feedback from the educator, it is difficult. We have a feedback form we provide the educator and ask for them to kind of rate our service and any comments. We've tried multiple different ways to get that data. We have a QR code, we have a paper form, we have an online form, we have a live link. What we find works best is on the last day of the session, we hand physically at the beginning of the session, we hand the educator the form. And that's been the best way to get it back. But it is very difficult to get feedback from the educators on how things are going.
Well, I'm glad that there's a system in place, but that does it for the questions.
I do have one last one.
Oh, okay.
I can jump in because it actually is something that we didn't talk through, but I know as we had an opportunity to chat about remote management and remote management of your team, right? It's not like you physically see them. You often never see them or occasionally see them. How have you used reports in the tool to actually support understanding operationally their workloads and helping them as they, maybe are managing a bigger workload than they should be, and working through what I'll call those operational efficiency metrics?
Yeah, and this has been a really challenge for me because I come from a community-based organization where I was on site. And historically in that system, we were required to report how much direct versus indirect time to the ministry in the community setting. Coming to a school board, none of that is in place. So what I do is I use EMHR's got some, well, most of EMRs have some cool features where you can see the staff's dashboard. So prior to supervision, I run a report of their active files. I run a report of their dashboard to see like how many, because you can see how many contacts they put in each day. So then I can see how many students they've seen. If there's days without contacts, then I'll look at their schedule and ask like, how's it going? What's going on this day? Is there an issue with completing case notes? So by running reports, I can see how many students they've seen. I can see their caseload. I can see how long it's been since they've carried files, and I can also see how long they've been without contacting people on their file. So I run those reports prior to supervision so that we can have a conversation and in a supportive way, just how's it going in looking at this. And I can also run reports on how they're spending the bulk of their time. So are you spending, I noticed you're spending a lot of times consultation to principals. Is there a way I can support you with that and take some of that work on? So I use that to get a sense of what goes on in a day, because not being in the building, you just really don't know.
Yeah, absolutely. And you know, you're in a really complex environment in that your number one priority is supporting students and making sure that the right things are in place so they get the help they need, but it's also helping the clinicians on how they're executing their work so that you can take some either workload off or make things easier for them. And then you've got the further complexity of, you know, teachers and administrators are also human as well. And we understand the kind of the interplay between a teacher who may be struggling in that class. But Lisa, this has been a really interesting conversation. Thank you so much for sharing your time with us and giving everybody just a little bit of a window into the hard work that you have been doing and what's coming next. So thank you. Absolutely thrilled to have you as a partner. And really appreciate you taking your time to do a webinar with us today.
Perfect. Thank you very much for having me. And yeah, if anyone has any further questions, feel free to reach out.
Perfect. Okay. Thank you so much, everybody. Thanks for participating. Be on the lookout for our next webinar in the webinar series. Peter will certainly be putting something out over the next 6 weeks or so. But thank you so much for spending your time with us today at lunch. We will be back soon.